So what we've been hearing is a huge variety of issues. This is quite an agenda about financial and non-financial incentives and choices in the environment to try to increase fruit and vegetable purchases and obviously then consumption. We were talking about that. We talked about settings, the big differences between farmers markets, small groceries, and large chain groceries. Sustainability and potential for spread of these sorts of incentives because of the enormous cost and what the real impact is. So listening to all of that, what we wanted to hear from all of you is a little bit about what kinds of these changes, the financial and non-financial incentives, the changes in how farmers markets and groceries operate to enable these things to happen, the nudges that can occur, the support in the communities. What sort of changes like that can be prompted by government action, by policy at all levels, community, state, and federal? And the second part of that, which gets to our research and evaluation agenda, is that, gee, if there are possibilities for policy support or program support from public agencies, what is the case that we need to make to them? What is not just the evidence for the program, but what is the business case, the value case that we need to make? So I don't know if one of you would like to start out, Kimberly?
Hi, I'm Kim Hodgson, and my work has focused on the role of local governments in supporting food access and healthy incentives and so on. And actually, I had wanted to make a few comments based on the earlier conversation, so I'm glad I have an opportunity to kind of integrate those comments and also respond to your question. And what's really exciting for me is that there is a major role local governments can play in supporting some of these federal initiatives, federal grants, foundation grants, and so on to add to that sustainability component that was talked about earlier. So what happens when the grant money runs out? Well, local governments can support those efforts and make sure that they continue. And I have some very specific examples to share, but I will hold off for a second. But I would like to also mention that beyond the funding, local governments can play a very important role in incentivizing healthy foods through non-programmatic work. So regulatory changes, creating standards, creating incentives, whether they're tax incentives or development incentives, and also through funding, maybe not programs, but staffing positions, providing the capacity to actually be able to work on some of these initiatives. A lot of times local governments don't have the staff capacity to work on some of these programs, so ensuring that they actually have the staff capacity to do so. And then I also wanted to make another point, is that taking a step back from these the farmers market incentives as well as the retail incentives, what if you live in a community that has nothing to incentivize? So maybe there is no grocery store, no retail environment, there is no farmers market. So if you want to incentivize, a low-income household to eat a certain way, where are they going to go? So that's one issue that people working at more the federal level can think about, working with their local level officials to figure out, well, what is the context? What are maybe some more flexible ways to address the issues? And then in terms of that flexibility, so grocery stores are really important, but what about a virtual grocery store? What about a mobile grocery store? What about some of these non-traditional ways of reaching a population that really needs the healthy food access? So thinking about some of those ways, and there are some really great examples across the United States that I would like to share with you today, but I just wanted to make those 3 points. And then the last point I wanted to make is when a local government decides whether to tackle these issues or not, it's often important for them to understand well, has someone else tackled this issue? Can I learn from someone else? What worked, what didn't work? And oftentimes that evidence is not available. A lot of local governments are not sharing their success stories, and so there's a role for researchers at the national level to help with that.
So, do I need to? Okay, so I guess my name's Paula DeAnda, so I guess in some ways I'm a representative of local government, because for 8 years I was with Mayor Villaraigosa in the city of LA, and I was first a public works commissioner, different story, but I ended up being a senior advisor on food policy to Mayor Villaraigosa, so we worked a lot on these programs. We also created the U.S. Conference of Mayors Food Policy Task Force, and we worked with mayors around the country. That's how I got to know Kate on these very issues. So I'll answer your specific question, but I want to put a little more context on it too. I think specifically, obviously, if there's health outcomes that you can document, that's going to be important for any local government. We did not, the city of LA had a unique structure, or has a unique structure, in that it is divided from the county. The county runs the Department of Public Health. We don't have a Department of Public Health. So we weren't really looking at health outcomes in the city, but it was something that we felt was important to address from a socioeconomic standpoint anyway, and so we partnered with the Department of Public Health, and they were quite thrilled about that. But part of the case I had to make as somebody advocating for a lot of these changes to take place was an economic case as well. So WIC has economic return. There's a lot of local benefit, the local economic multiplier, which is in the Fair Food, I left it on the table, but the write-up on the Fair Food Network program. That's pretty important, and especially because we were trying to start doing this work on food when we don't have a health department in 2009, right after the recession. So to make the economic case was pretty significant. And that leads me to the point I want to make, is that all of this sits within a larger context. And the context that even, you all know this already, but I just feel I want to say it for the other points I want to make, is that the context which creates obesity these days is definitely socioeconomic. So one of the things I want to introduce, one way I want to introduce myself to you is to say also that I grew up eating Spam. I'm from Hawaii. I'm a registered native Hawaiian, and I think it was every Thursday my mom served fried Spam and white rice and a fried egg and ketchup. I'm not kidding. Hawaii has like the highest per capita consumption of Spam in the world. Why am I saying that? Because in Hawaii, the issue of obesity there is not as concentrated geographically as it is like in Los Angeles. We talk about the obesity rates correlating with poverty, obviously, but that also tends to cluster in South Los Angeles, but that's the way it works in LA. But in Hawaii, the Native Hawaiian population has the same statistics of obesity as people in South LA, 3 times the rate of the rest of the population, and they're dispersed throughout Hawaii. So it's not just geographic, and it's not just about what you're able to find in terms of healthy food retail. A lot of it has to do with the decision-making processes of poverty. And I'm sure you've heard about the allostatic load and what that does to decision-making. So I think that factors in so much, and I think it's an area that's important to look at in terms of all these incentives that are being provided. There are a lot of incentives, but the decision-making process is still very stressed. One of the things, and I don't know that there's study on this, but one of the things that I have just found, this is intuitive, but it also ties into some maybe a larger frame, is that growing your own food can have a huge benefit, more than just the production value. So I think it's the case that obesity rates pre-1950, the lowest income communities had the best diets, actually, and they were not obese, right? Part of what it was that we didn't have the proliferation of fast food and junk food and the easily available cheap food, but also people were growing their own food, victory gardens. My grandparents in Hawaii always grew their own food, and they used gray water to do it too, by the way. But just to tie it all in together, since I'm from California, we're focused on a drought too. So, but, the fact of growing food, which is absent from a lot of people's lives, makes a huge difference in how they appreciate food and think about it and the choices that they make. Even if they're only able to grow one salad in a month, they're growing that food. How many of you grow your own food? I bet a lot. Right, so I can't grow too much, but I grew a Meyer lemon tree, and I used to just squeeze lemons and throw them away. I didn't really think about it, but that Meyer lemon, it's like I'm peeling the peels and I'm candying them, and I'm using every bit of that fruit that I grew because I have a relationship to it. it does make you start thinking about food differently. And I think particularly for lower income communities, if they're able to garden and grow a little bit of their own food, it gives them a sense of sovereignty in some ways. Like they have a little bit more control over what they're growing and eating. And I think it radiates through and helps the rest of the decision making around food choices. So I remember trying to develop an urban agricultural policy and community garden policy for the city of LA. One of the people we had come talk to us, and I wish I could remember his name, but it was somebody from Detroit, where they're doing a lot of work in community gardens there in urban agriculture. And I was trying to get my hands on this information, but he said there is some information that the prison population, which they have a lot of in Detroit, when they started being engaged in the act of growing food, the recidivism rate dropped. That, I think, is such an important piece of information. And we're beginning to look at that, too, across the state. The largest food service provider in the state of California is the prison system. We have an awful lot of people in prison, a lot of people there who are going to be released because they're not there for violent crimes. And what's going to help them when they come out also and reintegrate into the community. And I wonder what the effect would be if we started growing food and serving that food in prisons as well. Obviously, school food's a big part of it, too, because a lot of choices happen through school food. So this is the last point I'll make so somebody else can talk. But the obesity rates for children in LA County are dropping. It's holding steady for adults. And we don't know exactly why yet, but it may be because we've been working a lot on school food. So the choices that are happening in the schools are radiating throughout the rest of their lives.
Hi, my name is Jacqueline Schneider. I work for the Senate Agriculture Committee, and just to tail on some of what you were discussing on the economics and take it up another level, I think one of the really important things with the incentive program and the connection to food is also, from a policy standpoint, the connection between the nutrition programs and the farm community. And I think one of the things that we've seen continue to grow with some of the incentive programs is more folks who are growing the food have an interest in who those consumers are. And as many of you may remember, in this last Farm Bill, we had a huge issue with a discussion over what the purpose was of pairing nutrition programs and farm programs together. And this is a really important time for us to talk about why nutrition programs and farm programs are related to each other. And people have, in many cases, increasingly seen a separation where, why do we care about the Supplemental Nutrition Assistance Program? Well, you're growing the food, and that's an important component. As a result of some of the incentive conversations, not only have we seen farmers markets very engaged in this space and relating both to the consumer, but also to the policymakers, the importance of the connection between farm and nutrition programs, but also at a grander level, when we were having conversations about the food insecurity nutrition incentive grants, we had people coming in that were, traditional farm commodity folks who had not engaged with us very specifically on a lot of nutrition programs saying, what is this? How can my farm or my farm organization be a part of the conversation related to nutrition and incentives? And there's this huge population out there that's receiving nutrition assistance. We would like to be a part of this conversation, which I think is really important for us as policymakers going forward, working on the Farm Bill. How can we strengthen that bond between the farm communities and the nutrition community even more? And I think that this is a real mechanism to continue to do that. It's great to hear farmers who traditionally have never asked about SNAP raise their hand, and their first question in a commodity meeting is, what is this incentive program and how can we get involved? So I think that's really important for us to continue to have those conversations. And the tangible effects on behavioral change is also very important. Mentioning school food, we have a great mechanism looking at some of the programs that are for schools and kids in schools right now that show behavioral change. My boss, Chairwoman Stabenow, is a big fan of the fresh fruit and vegetable snack program because we see schools have great results when kids are exposed to products that they'd never seen before, that they tend to be more receptive to additional products. That's a behavioral change that we're seeing as a result of the fresh fruit and vegetable program and exposure to products at the school level. Well, how can we do that at the parent level as well? The kids are coming home saying, we had, rutabaga today. It was great. A parent may have never learned how to prepare rutabaga, may not feel that they can afford to spend their budget on rutabaga because they go into the grocery store. And, I know many people who are guilty of this, my family as well. You look at a carton of strawberries and it's $5.99, and you see a bag of family-sized potato chips that's $1.99. We can tell people as much as we want, which is great, the messaging that the strawberry for the value is going to give you more nutrients. But when you look at the price, that's a hard message to convey unless there's some additional incentive. And one of the things that we looked at a lot during the Farm Bill was the accessibility of healthy products, fruits and vegetables and other healthy products to families who are participating on SNAP, the educational opportunities, how do we teach people how to prepare foods that they might not be familiar with and reach out to them, and how do we make it affordable? And I think every one of us in the room probably goes into the grocery store, sees a value, sees 2 for $1 on apples, and that may sway their decision towards buying an apple instead of buying another fruit or vegetable. How do we give that same value back to SNAP participants? And I think some of the data that we saw from HIP has some good evidence that consumers are seeing a value there. And I think one of the federal roles that's really important as we go forward on incentive programs is to look at all of the different mechanisms that are out there that are working and what is the best. What is the best type of intervention that works? And I think that's a really important role for us to play. There's a lot of great data out there from a lot of the groups that are engaged in incentive programs right now, but by looking at it from a federal standpoint and looking at the incentives at different levels, at different interventions, whether it's retail or farmers markets, every community is a little bit different. How do we look at the evaluation and try to put some frames, not that every program is going to be the same, nor would we want it to, but how do we start to examine from a baseline, here are the types of interventions that are having the most positive impact. What can we replicate? How can we develop technologies to make it more effective and efficient? How do we move technology forward to streamline the process and try and make it very user-friendly for both the retailer, the farmer, the consumer? How do we do that best? And if we're going to continue to expand incentive programs, what are the best practices that we can convey back to folks on the ground on how to do that? So I think that's a really important role that a federal program can play, even though there's some great things that have been going on at the local level with nonprofits and local communities. How can we provide some additional structure to the evaluation so we know what's really working when someone wants to come in and say, I want to do incentives at my local farmers market? So that's something that we would really like to see come out of the incentive program that we're hopefully going to be hearing more about in the very near future.
So I want to build on that. First of all, I have to say I'm a big fan of Senator Stabenow. I think she's been amazingly courageous in her work there, especially on the Farm Bill. So one of the things that I want to add to this is the context of community and peers as being really helpful in making healthy choices. So I founded the LA Food Policy Council in Los Angeles, and one of the programs that we developed, well, one was a good food procurement policy for major institutions, including healthy, and that the school district adopted that. So that's had a significant impact, we think. But the other relates to corner stores, because I think most of you know, I mean, we call it different things in different cities. I think in New York they call it bodegas. I don't know what other people call them. We call them corner stores in LA. They're not even on corners necessarily, but small markets. And there's higher, we all know this, right? But there's higher concentrations of them in lower income communities. But most of those owners are also tend to be residents of the community. So they have a stronger relationship to the community than others. So they're really important. And this notion of economics that I mentioned earlier is significant for a city. Like, what sort of economic development is happening in a city? So to have a corner store, bodega, serve healthy food and have them have a strong relationship with the neighborhood that they serve and have it be productive is really important. So we decided to focus on that. And in the LA Food Policy Council, we decided to scale and try to leverage the work with corner markets, because there's a lot of conversions happening throughout the country, I think. But to really sort of maximize the impact, we created the Healthy Neighborhood Market Training Program. So Claire Fox, who's the Director of Policy and Innovation at the LA Food Policy Council, has these cohorts of store owners, so there's about 100 at a time. She brings them together in a conference-like setting, and they get information about how to source, they get information about EBT, they get information about incentives. One of the things I want to tell you about it, you all remember, you may remember, some of you may be too young, in 1992, we had some riots in Los Angeles. Part of the issue was that there were a lot of liquor stores concentrated in South LA, owned by Korean Americans that were mostly serving alcohol, and that was considered a problem. The reason I'm bringing, and it is a problem, right? So the reason I'm bringing this up is 20 years later, we held a healthy neighborhood market training program targeted directly to Koreans who were primarily owning liquor stores, but they came because they wanted to be able to figure out how to serve something else. And there were a number of them in that cohort, and I have to tell you, since I was in LA during that time and remembered, what happened with the riots, it was very moving to me to see 100 Korean Americans. We had translation going so that they could understand what was being told. We had somebody from Health Foods talk to them about sourcing. All of that really important, and we have a number of them in our cohort now, and some who are choosing not to serve alcohol at all and are serving produce, selling produce. But we also tie this into the community. So we're building demand through community engagement, through adjacent high schools, developing relationships between the corner store owner or the store owner and high schools. I think we may be seeing a video on this later on today. And it's still a new program, but I think those types of stronger community connections around that market can not only help that market survive, but can also create a network of choice in that community that I think would serve toward the healthy choice. It'd be interesting to watch how those kinds of community relationships can serve over time the objectives.
And I would like to echo the comments of both Paula and Jacqueline about thinking about these multi-benefits, so beyond just the health benefits, but the economic benefits. Local governments, for instance, have to deal with a variety of issues. They have to deal with providing a range of community services. They're not just focused on health. They're focused on education. They're focused on housing. They're focused on land use. They're focused on solid waste. There's so much that they have to think about. And so when thinking about incentives and policies, if something can have multiple benefits, it's going to be much more desirable to them than if something has only one benefit. And so if you're thinking about limited resources at the local level, those resources can go much farther if they have multiple benefits. But a lot of what I'm talking about today is based on actually a USDA-funded project called Growing Food Connections, and it's the role of our building local government capacity to address food access while simultaneously supporting area farmers, and it's funded by the USDA's NIFA AFRI program. And I just wanted to mention my co-investigators on the project. I need to give them some recognition for their work, but that's Samina Raja at University at Buffalo, Jill Clark at Ohio State University, and Julia Friedgood, American Farmland Trust. But we have been involved in interviewing local governments across the United States to find out, A, how are they addressing this issue of food access? B, what are they doing about it? C, how are they incentivizing local foods? And then, how are they connecting the dots and creating these multiple benefits? But in my previous comments, I had mentioned the issue of funding and, what is the role of the local government in providing funding? And so one city we interviewed is Seattle, and they also have a double value redemption program for their farmers markets. And what's really interesting is that initial program was funded through a combination, I think, of federal, state, and foundation dollars, but definitely not local government dollars. And they really did a good job of tracking and evaluating the success of the program in improving fruit and vegetable purchases. And it was shown to be successful, and so the local government said, oh, this is a great opportunity to support our farmers, but also to improve, the health of our residents. And so the local government now is paying for 3/4 of the funding, which I think is a very, very unique example because it's coming from their general fund. There's now a policy that states that this money is going to be coming from the general fund for the next, several years. And so that's one example. But another thing I wanted to say is that it's possible to, through funding and through incentives, fund or incentivize things other than the financial component. So what are some of the non-financial incentives that can incentivize healthy food? And so one of these examples comes from Lawrence, Kansas, and it's a much smaller community. It's not a Seattle, it's not an LA, it's not a New York City. And so they have less resources than some of those other cities. And so two ways that they are incentivizing healthy food is, one, by giving free access to vacant property for community gardens and food production. But part of that agreement with either a farmer or a nonprofit organization that wants to establish a community garden is that they have to show a community benefit plan. So how is this community garden, how is this urban farm actually benefiting the community? So they have to show that. So, they're getting free access to free land, but they have to show that community benefit. And then the second is Lawrence is also incentivizing healthy food through a CSA, a community-supported agriculture program for their employees. And Baltimore actually is doing a similar thing. And while Lawrence doesn't provide any kind of added funding for that, Baltimore does. So Baltimore now, as part of the wellness benefit for their city employees, they provide, I think, $275 per employee towards a community-supported agriculture program. So I think those are two interesting examples. And then last, I wanted to mention, I had spoken previously about regulation. So how do you incentivize healthy foods through regulation? And I know that's more the stick approach than the carrot approach, but it can complement some of these carrot approaches, I guess you would say. And so there are two things I wanted to mention. First is the city of Minneapolis has a staple food ordinance, and basically it requires all grocery stores to stock certain types of foods. And so they have a list of what these types of foods are, but it's requirements for perishable foods, so fruits and vegetables, meat and dairy, and other healthy foods. And so that happened in 2008, and they have been working on implementing that, but they've found that a lot of stores don't know how to comply with that regulation. So there's where you have, an example of where it's important to have maybe some of the more education and programmatic work. So there's a Healthy Corner Store program that's now helping to help grocery stores comply with that regulation. And then the last example I wanted to give related to regulation is back to Minneapolis. Minneapolis had a public market, so a farmers market ordinance that allowed for, farmers markets in different areas, but there were certain requirements related to these farmers markets. And one thing they realized is that there was a need for a more flexible model so that these farmers markets could then go into maybe some of these low resource communities that, couldn't support a regular size farmers market, but maybe could support a smaller size farmers market. And so they revised this ordinance and created what they call a mini market ordinance. So they have this new regulation that allows these flexible 5 vendors or less mini markets, so they're mostly farm vendors, but into these these little resource communities. And what's interesting is that it enables farmers to then partner with churches and community centers and some of these other organizations that serve low-income residents to get these mini markets in a place where they're not necessarily there.
Go ahead. I'll be really short. I think one of the things that we heard during the Farm Bill when we were talking about trying to expand healthy offerings in some of the stores that may or may not have as many healthy offerings right now. We all think of big grocery stores. There's a whole fruit and vegetable section, but you go into the local convenience store, corner store, small grocery store. In some cases, those offerings are limited. And one of the things that we heard from a lot of folks was it's not that we don't want to, it's that we don't know how to get people to buy it. And we have this donut hole and products that people come in and buy, and then we have stuff that largely sits on the shelf, and they, in many cases, lumped some of the produce and things like that into the same category. But they have declining revenue in certain areas like tobacco sales and areas where they're looking for a new opportunity to increase revenue to make up for some of the sales that they're losing. But in many cases, they don't know how to bridge that gap between what their customers want and what they've been offering and more healthy offerings. And many are interested in more prepared foods, more fruit and vegetable offerings, but trying to figure out how to package it, make it appealing to their customers, and make sure that it isn't a profit loss. So, you know, while we're simultaneously pushing retailers to offer more as a part to participate in programs like SNAP, they're also looking for help and assistance in many cases in figuring out how to do that. So I think there's a real opportunity with some of the programs that you all are describing to really seize on the moment where those tobacco sales are going down. They're looking to backfill with something, and some stores are already doing it. You know, I drive home to Michigan, and there's a very specific gas station, convenience store that I always stop at because I know that they have a lot of great packaged, cut up fruits and vegetables and things that I can snack on in the car that are easy and convenient, in addition to the typical fare that you see on your drive down a turnpike. So I think that we can try to look at a variety of different things, and I know many of the groups here are probably already doing this with some of those smaller stores, whether it's incentives or working with SNAP Nutrition Education or other programs that put a connection between the consumer, those healthy products, and the retailer. I know in Michigan, people get very excited about local produce. Sometimes that makes the difference whether somebody takes home an apple or not, you know, just because they feel a connection to the agriculture. If we can find more ways to get people excited about those products and help those stores to want to offer it because they see the sales and those items going up, that's going to be a benefit for all of us and some of the outcomes that we're looking to achieve.
So wonderful comments. We could go on this for several hours, but I want to just turn it to all of you and then to the audience, and thinking about all of the connections you've told us about. You know, we need to be looking not just at the retail outlet, but how we work across a community, both to enable those things to happen and to offer opportunities. It's not all financial. There are other kinds of things that can happen in a community. And also the connections to benefit. You were talking about in the Farm Bill and connecting closer to farm programs. You were talking about not only schools, but also what happens in prisons. And you were talking about all of the services that a community has to provide. And how does this fit in? How does it benefit all of the things that are on their backs to deliver? So in opening it to all of you, and to you guys first, this is really wonderful and a little bit of a perspective on what we've been looking at more narrowly over these workshops. But let's go back to the research and evaluation agenda. So thinking about all of these both barriers for low-income populations and opportunities to provide them with choices and incentivize them, what do we need to provide to policymakers to build that business case, the value, the return on the investment, in addition to behavior, which we've already heard is really hard to measure? So, you know, this is the opportunity for you to help us and you to help us think across the NCCOR funders, what could be real priority studies that would help build the case?
You know, I think it'd be really interesting to have a neighborhood-based case study. If you could look at a place where there had been a concentration of these types of, you could call them intervention or programs, where there's farmers markets, where you have convenience store that started serving healthy food, where you had, a strong connection to the community, and track that neighborhood over time. So you have a longitudinal study over a period of maybe 5 years, and to see if over time the eating behaviors changed. I think that would be really helpful, because what it could speak to as a policymaker then is that you could cluster these activities and really find, zones where you want to place them, and put a lot of other types of incentives into making that happen. I think that'd be great. I'd want to add into that, so it seems to me it could be an array of things. Like, you could almost pick a community and say, we're going to focus on this community and add in these programs. We're going to make sure there's a farmer's market. We're going to have community gardens. We're going to have the convenience store, help that convenience store owner sell healthy food and help them figure out how to market it. We're going to tie in the high school and the elementary school that's nearby into this. We're going to have the teachers get CSA food from the local farmers market so that they can be part of this as well. And if there's a cafeteria, the cafeteria workers will be involved in this. I mean, if you just think about what might happen if you could just pick a neighborhood that needs that kind of transformation and really focus on it and just see the effects over time. I think it would speak to larger scale types of adaptation of those issues. Adoption.
Definitely, I completely agree with those comments. I would also like to add that I am also a researcher, but also provide technical assistance. And so with my research cap on, I feel that sometimes local governments are not necessarily invited to the table to be a stakeholder in these types of discussions, but yet they're the ones that are on the ground, that are working directly with the people that these types of incentive programs are supposed to serve. And so part of my research is identifying these really innovative, interesting ways that local governments are incentivizing healthy food or providing access to healthier foods. But some of these initiatives are very new and haven't been evaluated. And so there's a real need to evaluate what's already happening. Why create new things when there's some really interesting, promising practices on the ground, whether they are programs, whether they're actual regulations, whether they are staffing decisions, whether they're tax incentives, whatever they are. There's a range of possibilities, and it would just be, I think, so important to understand the pros and cons of these, but then also disseminate the success stories to other local governments across the country. A lot of local government stakeholders, so whether they're elected officials, whether they're department staff, they don't have the resources to travel to conferences. They're not hearing about this innovation. So how do you take that innovation and bring it to them?
I think for us guilty at the federal government, sometimes we want to make decisions based on a very short snippet of time that we've looked at something. Sometimes that's beneficial, sometimes not, but I do think that there's a great value to trying to look at a more extended period of time of evaluating something before we decide that an intervention doesn't work or it does work. In some cases, we have historical data that's not related to something the federal government is doing that we can rely upon, but in other cases, we try something out, decide that because it hasn't had, we haven't seen obesity rates go down 25% in 3 months. Gone. That program is ineffective. So I do think that there's a lot of value to looking at how an implementation of an intervention can happen over an extended period of time and what that means for our policy making. I would also say I think that there's a lot of value for us in having buy-in from not only local governments, local communities, but a variety of different groups. So one of the things that is continuously challenging for us when we're looking at something that may even have good statistical results, something that we can point to and say, this is working, this is effective, it's being adopted. If someone in the local community is saying, I don't like it, and going back and talking to their members of Congress saying it's not good, it's hard to make the case and convince that person it is. So the more people that we can get bought into the process at every level, from retailers to local governments to nonprofits to farm groups, the easier it is when something is effective for us to say this is something that we need to support. So I think it would be great for us to see some projects that are broad and involve a variety, not only just targeted to one community with a variety of different interventions, but the same type of intervention hitting multiple different communities. So you can see, for example, if it's successful everywhere, it works at farmers markets, it works at CSAs, it works in small towns and large towns, that's great. Or maybe it works better in one area or another, but the more we can get people bought into a concept and idea and have them engaged in the process as we're evaluating, it helps us for them to then feel that they've been a part of the decision-making process, and then they're more willing to come in and say, I have experience with this program or this idea, and here's what's working. So I would like to see a lot of different partners involved in a lot of the conversation to make sure that then whatever the message is, we have more people who are engaged and want to tell their members, this is a great idea.
One other thing, too, that I can't believe I forgot to mention when I was describing this utopian vision of a neighborhood that we were going to study, because it would all be, it does, doesn't it? I want to live there, too. But I forgot to mention fast food outlets, when I can't believe I forgot to mention it, because LA is one of, I think, the first cities that adopted a fast food moratorium in South LA, which has the high concentration of obesity. And the reason I'm bringing that up is I think obviously it's interesting as a layer. So all the food choices are made in a whole context, which is why I described that context. There's something very specific we could look at too, and just in general, is meat consumption. So the U.S. is one of the largest consumers of meat in the world. The first is Luxembourg. I'm not really sure why. But the U.S. is the largest consumer of meat in the world. We're the largest producer of beef. The rest of the world is eating fish. So the rest of the world is eating farm fish, too. In 2012, this started happening, that fish consumption overtook beef consumption, and farm fish consumption overtook beef consumption. So, and there's, obviously, you all know the health benefits of eating fish. I mean, I actually came across something interesting. Eskimos who were not even eating vegetables, this is Eskimos in Greenland, the Eskimo tribe, they're not even eating vegetables, they're in Greenland. They ate a lot of fish. They had lower risk of cardiovascular disease than their urban counterparts. So, obviously there's a lot of other issues that come into play, but that, I don't know that produce is necessarily the health answer. It's a big part of it, but meat consumption is going to be a big part too. So maybe looking at those particular dietary habits, it's a very specific issue, but how do we shift more to seafood consumption in certain neighborhoods?
Okay, so I want to thank you all very much. This is just wonderful, but I want to give the audience a chance to chime in too and ask questions of our panel, Jacqueline, Kimberly, and Paula, or comments of what they've been saying and how it applies to the research agenda. Yes. Well, but we've got people online listening, so
Okay.
Thank you.
Thank you. I actually have three thoughts. One is that NCCOR could convene a kind of telephone conference of a lot of jurisdictions that are working with small corner stores, for example, or bodegas. Because one of the things that we have found is that many of us, we have no real money for research. We spend all our money on the ground hiring people, et cetera. But many of us are asking the same questions. And so if we could all ask the same questions, whether about changes in the small corner stores or things like that, we would actually have some evidence that might be helpful without spending a lot of money on research. So that's the first thing. I have found that consumption is often harder to look at than other things, like sustainability in a free market business. We have recently found that we have these fruit and vegetable carts in New York City in lower income areas, and interestingly enough, over time, they have brought more fruits and vegetables into the small corner stores. And that's been sustained over 2 years, but our consumption data doesn't show that. So we know people are buying it, right? It's a free market business. It wouldn't be there for 2 years later if people weren't buying it, but we can't pick it up. And the third piece is that I think that the one place we're missing in this discussion is at the distributor level. So when you're talking about building constituency and you're talking about going into a significant number of retail food stores, oftentimes that kind of resonates to the distributors, and if the distributors are offering discounts for certain kinds of foods, or if you can pressure the distributor or the company to lower, for instance, in New York City, we convinced Goya to reduce the cost of their low-sodium canned goods to the same as their high-sodium canned goods. And that was just from the swell of the constituency in the neighborhoods, kind of, and the small corner stores asking for it. So those are the three suggestions.
Thank you. Who's next? Yes, please. And I should be asking, would you identify yourself too?
Okay, sure. My name is Michel DeShawn with Wholesome Wave. And just speaking to the power of local governments, one of the things that I heard from all the three panelists, and I just really love to weigh in favor, is taking a look at all-out community interventions. I think there's no question that pretty much everybody in this room could shop anywhere that we want. So we have the full availability in our battery of healthy food choices for our families. We have farmers markets, we can shop there, we can shop at a Stop and Shop that has more affordable and even local produce if we want. We can shop there, we can shop at Whole Foods. In these communities, there's nothing. So I think unless the full context of availability is there and we study that, we're not getting to those sociological implications of the stresses that these shoppers are under. So when we look at gardens, and I'll just remind everybody that in 1942, 48% of all fresh food consumed by Americans came from privately held victory gardens, not even farmers markets or grocery stores. So there are important implications there. A partner of ours in San Diego set up a 3.5-acre community garden where Somalian Cambodian residents bought agricultural plants with their SNAP benefits, planted the garden, and were able to sell the food at the City Heights Farmers Market in San Diego. Being able to study the impact of what SNAP can do to a personal family's economy, I think, is important. And then in Boston, again, to the power of local governments, Tom Menino took our doubling program that's called Boston Bounty Bucks there and added fish to doubling because of the implications for improving the quality of protein in a diet. So I think if you look at a community intervention like this, and we look at incentives across all platforms, retail, farmers markets, et cetera, and even consider access to other healthy foods as well so everybody can play a role, local governments will automatically have a place at the table in this conversation.
You know, Michelle, so awesome. Thank you. I love that, those ideas. But I want to add on to that, the idea of layering things into a community is already beginning to take effect in Los Angeles. We have the Promise Zone initiative, which I'm sure many of you have heard of. So it's a designated area for federal grants, and there's an ability to combine them. And so we are working with the Youth Policy Institute in the Promise Zone in Los Angeles that hits those heavily impacted areas to put in a CSA, to do all these things that we're just talking about. So I think it's not too far from being able to be accomplished.
And I have a recommendation for NCCOR moving forward. Where is HUD in these discussions? Where is the U.S. Department of Housing and Urban Development? They're the federal agency that has those connections at the local and regional level that might understand more of the contextual issues that are funding these sustainable planning grants and so on. I mean, I know that USDA's Food Compass actually lists all the federal grants that are out there, including HUD's grants. So I highly recommend that HUD be included in future discussions, because then you'll have more of that linkage to local governments. And then the other, perhaps, linkage, if you want to tap into maybe some progressive local governments across the United States, there's the Urban Sustainability Directors Network. So these are the food policy coordinators for a lot of local governments in North America that already have, monthly webinars talking about these issues. So it could be really good for research, for someone from NCCOR to maybe sit in on that, or have like a little focus group or something like that to have more of a connection.
Good. I'd agree with the HUD point. Just want to echo that simply because one of the things that we see in Detroit is a revitalization, including the agriculture and food economy being a central force, not an add-on, but a central force in neighborhoods, in urban agriculture, in schools. Detroit Public Schools doing a ton of community gardening and working to bring those products into the schools and teaching kids about farming, and parts of the neighborhoods being transformed because there is now a community garden that was previously in an area that just had abandoned houses, and now it's a central force of community good, and there's a lot of great groups that are doing a lot of great urban ag work, and Eastern Market serving as a hub where you're bringing people into the community that might not normally be in that area, and redevelopment happening around food. So the more we can try to integrate some of those discussions into other agencies' conversations as well. We've heard from a variety of folks that have said, I don't just need an abandoned house or building torn down in my neighborhood. We need something that makes my neighborhood look more appealing, and in many cases a community garden and urban agriculture makes that difference for some communities, and not only looking more beautiful but being more appealing to families who want to move into that neighborhood. So the more agencies we can involve in these conversations related to food, I think that will be helpful for us to have a lot of buy-in around the food-based economy and access to food as well.
Yes.
There's some new funding.
And just identify yourself.
I'm sorry, Lynn Silver at the Public Health Institute. There's a few new local government approaches that are being used. One is zoning codes to look at availability of foods, which are being increasingly used throughout California. In California also, the cap and trade funds are generating investments for sustainable communities. I think it's not entirely clear yet whether and if there'll be clear food-related components in those investments. And then, like, the Federal Reserve is also looking at creative uses of community reinvestment funds to promote health. And I think any of those three approaches could be, as they are put into effect, and ideally I think we'll see some experimentation around food goals of getting food commerce into underserved neighborhoods that both increases the good stuff and decreases the bad stuff. Then I think those will provide important opportunities for evaluation in terms of local government approaches to improving the food supply in communities that should, and having a strong evaluation component should be planned right from the beginning as those types of experiments get rolled out.
In Los Angeles, we're embarking on adopting the health element of the general plan. So we have a website that I'd encourage you to look at. It's really great. You could Google Plan for a Healthy LA, and there's layers of information on an interactive map. Demographic information, health information, crime information, retail information. It's a really incredible planning tool, and the food system has a prominent role in that. And I also have a colleague in the governor's office, Elizabeth Baca, who's a physician, who's working on helping to create these health element plans throughout California. So that planning component is really significant, which I'm sure Kimberly has some thoughts on.
Yes. So I'm actually a planner by training, but I'm also a registered dietitian, first dietitian, then planner. But anyway, I used to work for the American Planning Association here in Washington, D.C., and actually was a Robert Wood Johnson Foundation Healthy Eating Research grantee, and did a project just on that, the role of planning in zoning and improving food access and availability of healthy foods. And so I actually did a report where I did a national survey, figured out who's planning for these issues, which communities have a health component to their plan, which ones are creating goals, policy decisions, changing their zoning ordinances to address these issues. So there is a lot of wealth of information out there. However, a lot of what I found in that study is that while local governments are changing these zoning ordinances, they're not necessarily researching the impacts those zoning ordinance changes are having. So, but again, local governments don't necessarily have the resources to evaluate.
Zero.
Yeah.
To evaluate.
Yeah. So American Planning Association is continuing to do a lot of this work on health and food systems. So I do highly encourage you to continue to look at what they're doing.
So addressing this afternoon how to make those links between researchers and communities who have zero resources for that kind of tracking evaluation. So thank you so much. A round of applause for this panel.